Want to go on ahead and get started. For those of you who are new to our coalition meetings, I am Sharon Tubbs. I'm the Executive Director for Health Visions Midwest, and I welcome you to our first meeting of 2025, and it promises to be a good one because we have a good speaker here today. I want to also introduce you to, I say introduce, but most of you know Nia Hinton, our Healthy Child Advocate. Nia is going to be doing quite a bit more with the coalition, so you will be seeing her face. She'll be coordinating for the coalition. You'll be seeing her face a lot more, and she'll be speaking a lot more at the coalition meetings beginning today. So Nia has our meditation.
Yes. Yes, good morning, everybody. This is my first time doing this, so bear with me. But today I just have a devotion for everybody. And just with the new year starting, and most of the time during the New Year's, we're always talking about health and wellness. And I think we formulate that a lot to our physical health, but I think our mental health is very important too, and our spiritual health is very important too. So today's devotion is choosing well. How different would it be if if you decided today to be done with your job, whether CEO, barista, or dance instructor? Your choice would be noticed. Lives would be changed. What would happen if you simply chose to not get out of bed tomorrow, or even change your hair color, or if you even decided to never leave your house again? That change has the potential to affect the trajectory of your life. Our decisions matter, and not just here on earth. God is interested in the choices you make. He has plans for you and desires for your life. But you have the final say. You get to choose. As you make the decision today, remember to put Jesus first. And I loved that devotion. And it was my devotion for this morning, and I really wanted to share it with you all. So it's just important that we choose well.
Thank you, Nia. Yes, that what would happen, and the choices that we make are so impactful.
Yes.
Okay, so thank you for that. I'm trying to get all these folks in here. So after we do our devotion, thank you, and gets kind of settled into the meeting here, from all of the hustle and bustle of the morning and getting ready and getting to where we want to go. We want to definitely introduce people who are in the room. I see some interesting folks coming in the room here. So we want to do some introductions so we know who is here, and so that our guest speaker knows who is here. So we will just go around, and I'll call everyone out. We will just go around, introduce yourself, say your name and which organization or cause you represent, okay? All right, so let's start with Miss Peggy.
I'm Peggy Hayes. I'm in Fort Wayne, and I work for Health Visions.
All right. Nia, we have already met. Sandra Thomas. Sandra, you're on mute.
Thank you so much. Good morning, everyone. My name is Sandra Thomas. I am a client advocate at Cancer Services of Northeast Indiana.
Awesome. Miss Pat.
Good morning, Pat Turner with Tobacco Free Allen County.
Ready? Angela.
Hi, my name is Angela. I'm with Fifth Third. I don't necessarily have a set cause, but I try to help my clients get to wherever they need to find different sources. So I go out in the community whenever I can to help out.
You said you're with the third?
Fifth Third Bank.
Fifth Third Bank. Oh, okay. Gotcha. Angela, is this your first time here?
Yes, ma'am.
Okay, let's give a little round of applause for Angela. Thank you for coming. We are so grateful that you have joined us today, and we hope you will continue to join us and become a member of the coalition.
Thank you.
All right, Miss Jeanette. Jeanette, you're on mute.
Hello, good morning, everyone. My name is Janet Med, and I work with Purdue Extension, Allen County, and I am nutrition program advisor.
All right. I think Jeanette, you've been here a few times. So thank you for coming again. Miss Jennifer.
Good morning, everyone. My name is Jennifer Rickard. I am an MSW student at IU here in Fort Wayne. I am interning with Stop Suicide Northeast Indiana. I'm working with Colleen Carpenter. This semester, one of my projects is going to be to try to do a community map of our mental health services in the community, actually in the 10 county area that Stop Suicide services. So that's a big project I'll be taking on. Hopefully I'll be meeting and talking to some of you over the next few months to try to help map this out. It's a kind of a pretty big project, but I'm looking forward to tackling it. So nice to meet you.
Awesome. And this is Jennifer's first time as well. Yay. She gets a virtual clap. Thank you for joining us. All right, Colleen.
Good morning, everyone. I'm Colleen Carpenter with Stop Suicide Northeast Indiana. Good to see everyone.
Thank you, Colleen. We know Miss Colleen. Esther.
Hello. Hi, good morning, everyone. My name is Esther Strong. I am with the United Healthcare Community Health Plan. Glad to be here today.
Yes. Esther, you've been here before, right?
Yes.
Yes. Okay. Anne.
Morning, everyone. My name is Ann Hall. I'm with CTN.
All right. Thank you, Anne. And it says Maria, but we know her as Lupita.
How are you, everybody? This is Lupita Valdez. I work for Health Visions, and I'm the bilingual community health worker.
All right. Sydney.
Good morning, everyone. I'm with the YWCA. I work as a community educator here in Northeast Indiana.
Thank you, Sydney. Stacy.
Hi there, I'm Stacy Kazmarek. I am with SuperShot. Yeah.
Okay. We know Stacy. We partner with them quite a bit. Kelly.
Hi, I'm Kelly from Associated Churches, Fort Wayne and Allen County.
Wonderful. And KMTHAA.
Hi, it's Kathy with the health department. I don't know why it shows up
okay.
that way still. It's crazy. But good morning, everyone, and Happy New Year.
Yes, Kathy. Okay, I'm sorry. I couldn't remember your name, Kathy Thorson. iPhone person.
I think that's me.
Yes.
Okay. Sorry about that. I'm not really sure how to change this on my Zoom app, but my name is Jamie Yates. I'm with Bowen Health. It's great to be with you all this.
Okay, we remember you from last meeting when you came into the conference room. So welcome. And then we have Cassius. Cassius might be doing double duty here. Okay.
Good morning. Good morning, everybody. Cassius Stallings, Wellness Coordinator with Health Visions Midwest. So glad you all are here. Look forward to this conversation.
Yes. Amen. All right. We have Kozin.
Hi, good morning, everybody. My name is Goldman. I am from the Catholic Charity. I work for the Burmese Health Collaborated Case Manager. It's a very newly for me.
Yeah, and isn't this are you here for the first time?
Yeah, I work at the health train at the Catholic Charity. I
All
arrived
right.
for way last year.
Okay, he gets a virtual clap. Thank you for coming.
Yeah, nice to meet you all.
Jeff.
Oh, good morning. I just got signed on here. Jeff Markley with the Positive Resource Connection.
Thank you, Jeff.
Sure.
I'm seeing something that says, oh, I think that's the notes. Okay. J. Myra Fields.
Hi, my name is Jamira Fields. I am the CKF covering kids and families outreach coordinator at Bright Point. And this is my first actual meeting. I went to the Christmas dinner or luncheon last month with you guys, and it was wonderful meeting you guys. Thank you for having me.
Awesome. Thank you for coming. You get the virtual clap. Lily.
Hello, I'm Lily Ganshorn. I'm the coordinator for Stop Suicide Northeast Indiana.
Awesome. Thank you. Glad to have you back. And I think there are a couple more, but oh, Diana. It's quite a bit more. Dr. Diana.
Oh, hi, good morning. It's Diana Jackson Davis with Parkview Health. I am the Language and Cultural Services Director. Work with a lot of immigrants and do a lot of community work. So glad to be here. I probably have the flu, so.
Oh, no.
Yeah, thought it was just a cold. It's the flu. So I'm listening in today. So good being
Okay,
here.
stay warm and drink fluids. I think you're supposed to drink. I don't know. Jackie.
Hey everyone, Jackie Martinez with the St. Joe Community Health Foundation. I'm in between, I'm in my car because kids had 2-hour delay and then they got canceled. So it's that kind of morning. So,
oh my goodness. Okay.
but I'm happy to be here with everyone.
Great. Sherry.
Hi, I'm Sherry Bowers-Duker. I'm a community engagement coordinator with Indiana 211.
Okay. Sherry, have you been with us before?
I have not. No, this is my first
Okay.
time.
Wonderful. Welcome. Welcome.
you.
You get the virtual clap. And now we go to Celia Reyes.
Good morning. My name is Celia Reyes, and I'm with I'm the community engagement specialist for MD Wise Medicaid.
Okay, MD Wise. Thank you, Celia. We welcome you back again. Sheila.
Good morning. I'm Sheila Curry Campbell. I'm with Pilgrim Baptist Church and Pilgrim's Progress Community Development Corp. Thank you.
Okay, we all know Sheila. And JJ.
Morning, JJ Foster, CRA Loan Mortgage Officer for Lake City Bank.
All right, thanks for coming again. Chris Howell.
Oops, unmute. Hello, I'm Chris Howe, Community Nursing through Parkview. I work with those experiencing homelessness. Not my first meeting, but I'm back. I used to be very, very in attendance and then work happened. So I'm making it happen today.
All right, wonderful. Glad you came back. And I'm losing track of where I was because people are coming in. Did we get Lori? Okay, Lori's not in. Rick Lee. Rick YLE. Okay, not hearing from Rick Lee. Cassandra.
Hello, Cassandra Rosine, Stillwater Hospice.
All right. Okay, so we've done our introductions. We know who all are here. Good turnout here. Glad to have you all. And I'm super glad because we have a wonderful presentation this morning. Carl Ellison is CEO of the Indiana Minority Health Coalition. And many of you may not be familiar with IMHC, but Health Visions Midwest is affiliated with that organization. When I started as the director of the Fort Wayne location 4 years ago during COVID, our connection with IMHC was crucial. We would meet every week and I would get so much information from IMHC, which is based in Indianapolis, but has affiliates all over the state. And we would discuss issues concerning underserved residents. And IMHC was the link for us to get to state organizations that could help us locally. So we were, Health Visions partnered with the Urban League and the Housing Authority at that time, and we were the first to bring vaccinations to Southeast Fort Wayne. And that was a byproduct of our affiliation with IMHC and the connections that we were able to gather there, and the work that Carl Ellison and his team do to support organizations like Health Visions and others that serve underserved residents throughout the state. So without further ado, Carl is going to talk today about the value of health equity. And his talk is so timely because of many of the issues that we are facing politically and socially in this climate. So without further ado, Carl, can you share your screen? Do you have that opportunity? Can you share?
Sharon, as the old school people I am, say, I usually have people to do that, but I'll see if I can do this.
Oh, do you want me to share?
Well,
yeah, okay.
Not successful.
Oh,
well.
Okay.
Do you see my presentation or?
Yeah. But did you want me to share it? Because I can share it for you if you would like.
If that works, I just want everybody to be able to see it.
Okay, because do you know how to put it on slide view and all of that?
Now you're getting technically beyond my pay grade here.
Okay, so let me share it.
Okay.
Okay, and I'll share it for you.
All right, I'll stop my share. Okay.
Okay, let me get my share going. Okay, can everybody see that?
Okay, I see a lot of heads nodding. So again, and thank you, Sharon, for the technical. Thank you for the technical assistance, and thank you all for attending this morning. And thank you, Sharon, for inviting me. I actually addressed this group about 5 years ago in 2020. And the slide, the presentation you have today is just an update of what I gave you 5 years ago. But Sharon told me I have 10 minutes. So this is a very, very, very brief synopsis of I hope that we can have further discussion. You have questions after I'm done. But that's a little bit more about IMHC. We are a 30-year-old organization. And unfortunately, or fortunately, I'm old enough that I was one of the original incorporators. So I've seen this organization grow from an idea to an institution over the past 30 years. As Sharon indicated, we have a statewide network. There are 20 local partners that we fund. We get $3 million a year from the state. It's in the state budget for the Minority Health Initiative. So we use that money to fund 20 local partners to primarily do health education and other activities, to be a presence, if you will, much as Health Vision is within your community, to promote minority interests. We also offer some direct services. We have doulas that operate in the South Bend, Elkhart, Michigan City area. We're also in the Logansport area. We have been doing, having doulas doing work focused on Black and brown women primarily since 2019. Those are funded with the so-called safety pin dollars from the state, along with some money from other partners. We also have done diabetes prevention activities for more than a decade through the Black Women's Health Imperative, a DC-based organization. This National Diabetes Prevention Program, we do it both in English and Spanish, and have been recognized by the CDC to be able to carry it out both in person and virtually. So it's a product area that will continue to grow because, of course, diabetes is so substantially difficult for communities of color. So we want to continue as a matter of mission, continue that work. We also have a relationship with the managed care organizations. So one is managed health services. And in fact, we're doing a project now with them that you may have some interest in. I would encourage you to Google MHS Serves. MHS Serves is a evidence-based project. In the first round, about $800,000 worth of funding went to entities to expand rural broadband. There's another round coming up that will focus on youth mental health. And then it's anticipated there'll be a third round sometime after the second half of the year that will focus on providing hubs and libraries for distance learning or for what amounts to various services that help people who otherwise would have difficulty traveling. Let's see, we were involved with the lead up to the what was called a long-term system support project. That's what's now known as Pathways. We did a lot of public hearing work around that and it helped to shape the Pathways project to some extent. We've also been involved nationally with something called the American Democracy Project. Again, it's Brown University School of Public Health. If you were to Google the American Democracy Project, you'll find a lot of the documentation of the work IMHC did and our local partners during the pandemic that serve as kind of a model nationally as to what you do, how you might respond in a situation. And then beyond that, IMHC as an organization provides a great deal of leadership. We have a permanent seat on Government Kids and Families of Indiana. We have a permanent seat on the Martin Center Sickle Cell Initiative. I served on the Governor's Public Health Commission that delivered the increased public health funding that we now have around the state. I serve on the Rare Disease Advisory Committee. I serve on the Indian Perinatal Quality Imperative. So so we do a whole lot beyond funding local organizations to try to impact public health in Indiana. And so next slide. And so just know that throughout our history, we were created to try to eliminate health disparities. In other words, our organization exists to try to see if America can achieve the dream of having the same outcome for all populations. And so our organization, along with local partners, including Health Vision Midwest, essentially operate and exist to try to achieve health equity. That's what we do. And so whether you look at the state's health goals, the national health goals, et cetera, in one way or another, they're all intended to produce a healthy America, which means that this America has some to a certain extent equality of health outcomes for all populations. Next slide. So there is now this anti-DEI inclusion policies which are becoming more public. And so the question is, will these affect our work? As you may know, our Governor Braun has dismantled the DEI components within state government. And we think that's a start, not an ending of this anti-DEI work. You also may know that President Trump on the federal side likewise is going after DEI. Now, I want to be clear, diversity, equity, and initiative kind of grew out of the American experience a few years back. I don't know, some of you that have been around public health will recall that like 5 or 10 years ago, we were saying that racism is a public health issue in this nation, right? So we've gone from racism being a public health issue to now we can't have diversity, equity, and inclusion as part of the way we operate. And so this insidious political philosophy infers that somehow working together toward common community goals, common community good on a cross-sector, cross-racial, cross-ethnic, multi-sector basis, as is evidenced by your coalition here, you sort of embody this, that somehow that is wrong. It also infers that having all voices at the table, providing information and passionate input in decision-making is somehow bad. And so we reject this anti-diversity, equity, and inclusion policies and the thinking behind them because they are destructive to the promise of America. Next slide. Next slide, Sharon, please. Okay, now, part of the reason that we maintain our steadfast commitment to health equity and to our mission of what we do is because Indiana and this nation continues to become more diverse. This slide goes back to that presentation I made in 2020. If I were to update it today, the numbers would be greater across all these groups. So, like it or not, our state, our nation, our localities are and will continue to become increasingly diverse. Now, we don't know what impact deportations and this anti-immigrant sentiment will have on that, but looking at demographic trends, we still are moving toward a point in America where a majority of America will be non-white. And that was originally projected as being 2035. But the reality is this nation will become increasingly diverse. So it's in the national interest to try to figure out how do we make sure our increasingly diverse population is healthier? How do we achieve greater health and well-being for all Americans? Next slide. Well, and so right now we're at a crossroads, and the issue is how do we respond to these growing pressures? And so what IMHC is doing is we're rolling out a modernized website to better tell our story. And we're also, as an organization, we'll do a membership campaign to increase the number of actual members who stand with us and support our work. Now, when I say doing a modernized website, by that, we will have video clips on it of us articulating health equity work. We'll have testimonies from people talking about what benefit they got from what we do. So we're going to go out of our way to do everything we can to demonstrate, if you will, the value of our work and the impact it has on human life. And the best way to do that is to tell stories. So as Sharon knows, and as we've been and said to all of our local affiliates, and we did this with agreement with the Department of Health, we put an emphasis on making sure when you report to us monthly, tell us your stories. Give us a couple paragraphs, because we then pass it on to the Department of Health, because particularly with policymakers, the legislators who we deal with, nothing's better than a story of something that helped the life of a constituent. And so we're going to use our website, which is really our front door. Encourage you to do the same, but make sure you tell your story of the work you're doing that is increasing value and saving lives in your community. We also will vigorously shout out remaining health inequities, particularly as it relates to infant mortality, life expectancy, and other health outcomes. You know, I'm amazed how many legislators I can talk to who don't still get the fact that in Indianapolis, if you live in Carmel versus downtown, you just go on trail, there's like an 8 and 9 year difference in life expectancy. Or if you're in Elkhart County, there are Black men who are dying sooner. In other words, their life expectancy is getting worse compared to white men than it was 10 years ago. So there are still significant inequities that we can paint, but unless somebody's articulating them on a regular basis, the policymakers and to the public, disparities just go unchecked, and the harm to communities of color is not, if you will, pushed back on. And so we are going to stay in the business of continuing to shout about adverse outcomes. You know, the part of the reason we need to do that is I testified to the legislature probably 2 years ago on infant mortality, and I took a graph which showed that in Indiana, Black babies who constitute 15% of births are 25% of deaths and have been that number for the last 30 years. I mean, I literally had a graph. Do you know that got absolutely no reaction? I got no question. I got nothing. Even though it's sort of a clear delineation of a health disparity that that causes this state to suffer. And I even went so far as to say, okay, now there are only this 550 or so babies that die per year. The Black share that should be 75, but it's more like 125 now. So we try to put things in very understandable, simplified terms to illustrate a problem. And sometimes work with policymakers, but sometimes it doesn't. But it still suggests our continuing need to still vigorously point out the areas that we need improvement in the society. And probably the most important thing we're going to do in response, and I would encourage you to do as well, and that is to strengthen your relationships and partnerships with your ally organizations. Now, one way we do that is that for the past couple of years, I have had a monthly touch base call with Cora Steinmetz and a predecessor as the Medicaid director. I've also had it with the chief of staff of the Department of Health. I have similar monthly calls with the heads of the managed care entities, some of the hospitals, etc. So my advice during this period we're now facing is that whether you're the leader of an organization or just a member of the organization, make time to have regular conversations outside of meetings with your allies out there who are doing similar work. Because you need to know what they know, and they need to know what you know, and you need to basically be able to work together toward common goals. So I always tell our staff, over communicate, over communicate, over communicate. You can never communicate too much, but in this environment, we need more and more of that. A prime example being, I'm sure you've heard that the state is asking managed care entities not to advertise Medicaid. Don't tell people that they can have this benefit that's out there, and do so on the basis because they want to reduce the size of the Medicaid population. Well, when government is asking entities that competed to deliver, for example, child services, because we have what's called risk-based capitated Medicaid in the state. So you have to compete for, you'll do X services for Y dollars for a population that you compete for. So to say now you can't advertise is sort of antithetical to the way in which we've set up these services in the state. But nonetheless, what that challenge infers for the rest of us is that if the MCOs cannot advertise, then we need to work with the MCOs to figure out how we can help them get the word out nonetheless. In other words, our pushback is simply to mobilize and do what we can within our communities to identify people who need care and then help them to get the care. It's sort of like everybody needs to join on to the Covered Kids and Families bandwagon because what Covered Kids and Families does now becomes all the more important if the MCEs are not allowed or discouraged from, if you will, advertising their service. I don't want this to be sort of a gloom and doom presentation, but I do think it's important for at this time for all organizations to essentially face reality, and that is we need to push back against prevailing activities which don't make a whole lot of sense to those of us who've been in the health equity business for a long time. Next slide, please. So again, my advice is just follow our lead. You know, we're at the local level, you can engage, educate, advocate, but mainly align as your heart in your coalition with other partners. Because it's up to us to be our brothers and sisters keeper. It's up to us to keep our hope alive. It's up to us to not allow what I would call the more narrow equality of health outcome, not allow that political posture to win the day in our state. There are too many lives that depend on us. And so again, I encourage you to act up and to be good stewards of your community. Keep doing what you're doing, and do not be deterred by what those on the right may want to cause to happen. I can tell you this, that that I don't think this time is so much a matter for community organizations that really focus on Black and brown population and others. This is more a challenge to organizations like the Anthems and the Care Source and others of the state to really be advocates for disadvantaged populations who may be adversely affected by policies, and to be prepared to join with us to say so. So it's a time where my advice is we need not have fear, just have to have resolve to do what we need to do to keep health equity a primary focal point for the state and for everybody who works toward it. Now, I could go on for another hour or more, but I've tried to be succinct as Sharon has asked, but I'd be happy to take on any questions you might have or to delve more into any of these topics I've touched upon.
Thank you, Carl, for that presentation. that was enlightening and thought-provoking. We are in a time where things are changing, and definitely the impact on what we do can be drastic. So what are the questions that you all have for Carl?
I have a question for Carl. So this is a budget year, we all know. Do you anticipate your budget being cut?
Well, the governor's asked all the agencies to find 5% of reductions. So typically that'll mean that I'll get a call sooner or later from the health department, Antoinette, or someone over there saying, we want your budget, or it will be, we want, first off, they'll probably tell us that they'll want to reduce our appropriation. So the 3 million becomes 3 million less 5%. But when we've done this before under prior governors, the devil in the detail is that when appropriation is made, that's only says how much money the administration can spend. They can always give you less than that. So we've also had years where the overall holdback might be 5%, but then our particular budget might have a 10% reduction. So it's something we have to keep up with, and something where we have a couple of lobbyists, one of whom is our a guy named Charlie Hiltunen, the third house advocate. He's been with us for ever since we existed. Well, Charlie is a member of Braun's transition team. Charlie also represents us, he represents NRA, and Charlie is, we have two lobbyists, one that represents each side of the aisle. And so we're going to have a special touch base call with our network on the 28th of this month. And we're going to have Charlie talk about his understanding of how Braun sees not just diversity, equity, and inclusion, but how he also sees and values like ours on a go forward basis. Now, we also work closely with the Black Caucus, so we talk to Greg Porter and those guys, and we know that the overwhelming emphasis will be on reducing Medicaid costs. And there's a whole lot to that $1 billion shortfall that didn't have anything to do with the rest of us. So we'll be carefully watching what happens during the budget process, but I would not be at all surprised to see at least a 5% reduction. Could go as high as 15%. And so we will have I think less resources to do more with, but again, it's early on. This is just speculation. Now, remember, session goes until April, so we typically don't know the end of the budget deal until you get toward mid to late April. But we expect some reduction, but we'll fight to try to have none.
Well, let me just put a plug in because I work for Tobacco Free Allen County, and so we're trying to get the cigarette tax increased. So that is one way they can make up some Medicaid dollars if they were to. So we're wanting folks to advocate for getting that $2 tax increase for cigarettes.
Amen. I'm amazed it hasn't already happened, because
I know, Carl.
Everybody behind this for all these years. And the evidence is pretty clear, and there isn't any doubt about the fact that we can or should have that. But
I know.
Yep. So it's something else we'll look at. Anyway,
I see a hand up, Sheila.
Yeah.
Thank you so much for being here. Pilgrim Progress in the Midwest BDC, we have a legislative day scheduled February the 18th. I don't know where you'll be at on that day, but I would love for you to be a part of our panel discussion. One of the areas that we're advocating for is infrastructure investment and clean energy jobs with childcare. We're focusing on, like I say, the workforce development, childcare access and affordability, behavioral mental health support. And so we'll have a full day. If you could drop your contact, I would love to invite you to be a part of that panel discussion. And we have a 56 passenger bus out of Fort Wayne. And so, yeah, thank you. I'm so glad I was here today. Thank you.
Okay, well, I'll give Sharon my contact. Sharon may have it to give to you. I can do that. But yeah, I don't think the 18th is necessarily going to work for me. Now, this activity is going to be, it's a third house there in Fort Wayne.
No, we'll be at the State House. We'll be on the 3rd floor, the South Atrium.
This is Saturday, the 18th, right?
February the 18th.
I'm sorry, I'm looking at my January calendar. Well, yeah, send me the information. I may well be able to do that. Just bear in mind that there's so many days of State House that I already have to be there, because we do one for doulas. There's going to be one for you know, we the rare disease advisory folk. We're going to have one for that population. But I would do my best to try to be there, and I will share the information, and thank you for the invite.
Thank you.
I have a question, Diana Jackson here. Just to follow up with Pat's question, because it is concerning with the DE&I efforts and the executive orders that was passed recently. And then as of today, on the federal level, the DEI department, all of the workers have been put on leave. If you've not seen that, that is happening actually right now. And so with the funding, the far reach, as I think about it, it impacts not just the Minority Health Coalition, but it can far reach into schools, school districts, because many districts have health programs as well that focuses, you know, on diverse communities, immigrant communities as well. I guess I'm just wondering, you know, what our next steps looks like. What should we be doing? How can we do things better? I know we can have conversations with allies, but what other things do you think that, you know, we can do? Because this will really impact, you know, a lot of communities financially. It will hit hard, and particularly Black and Brown communities. But we also know that in the state of Indiana, we have 42 counties or more that do not have primary care physicians. And those communities are primarily white, and they're also underserved. And so even the language itself, you know, I'm just thinking, what do we do? What do we do? I mean, because the removal of certain language too, from even training, not being able to use certain words, diversity, equity, inclusion, cultural competencies, all of these things may not seem like it's important, but it is very important, particularly when you're talking and working with communities of color and the underserved communities.
Well, Dr. Davis, if I had a crystal ball, I could probably give you the answer, but I don't know if there is one other than you just got to stay engaged.
Yeah.
And you know, it probably remains for us as leaders to do some of the hard lift. Like one of the hard lifts is just going to a school board meeting. Those can be very, very difficult because a lot of issues discussed there. But you know, if Governor Braun is successful in further expanding vouchers, you'll see more construction in private schools, and you'll see less supported public schools, and you'll see some predictable things which we can imagine. And you know, if that's the public will of the state, okay, but still, I think we've got to, as you point out, Dr. we've got to focus on the harm which may be created and at least state saying as part of the process. So I think all of you need to just stay involved and just remain vocal.
Thank you.
Carl, and I think this can be the last question unless someone else has something. I'm not seeing any hands up. Just to follow up on what Dr. Diana was saying, she was talking about not being able to use certain words and those types of things. And so I wanted to get your take. You and I talked about this a little bit. the other day, but I wanted to get your take here on what should we, you know, kind of rephrase our work in order to make it acceptable in this climate, because the words diversity, equity, and inclusion are no longer acceptable. So should we call what we do something else? Community wellness or something along those lines, so that we could fit within the rubric of what is acceptable in this climate. What is your take on that?
Well, good question. And a lot of organizations are struggling with just that very, very thing because nobody wants to be a target and nobody wants to go against the prevailing trend. But for some organization like ours, if your mission is to eliminate health disparities, you cannot not at least be part of the equity component of the DEI, and you cannot not be part of the inclusion part of it, because that's inherently what you do. So our view is, my view is that we're just going to continue to use the same language we have used always, but defend our work in health equity on the basis of we save lives. We're like the Right to Life folk. We really save lives. And those stories that we're going to articulate, that our constituents, our beneficiaries articulate, are evidence of that. The second thing is that we are a good resource for the state and have been for some time. The advice we provided around how we address COVID, the work we've done around infant mortality, we can point to issue after issue after issue where we've been value added to the thinking of the state. Other organizations are going to try to figure out ways to show that there's a return on the investment. You give us this dollar, we get that investment back. But preventative health outcomes are hard to document. So rather than going there, I'm going to put more emphasis around we save lives. We're in a life-saving business, and we deserve support for that, and we have had success at that. That also that we are able to reach harder to reach communities because of who we are. So we're a value component in the state's arsenal of effort, if you will, to improve outcome for our communities. We also, whether we're dealing with disadvantaged communities in Logansport, Elkhart, or whatever, a lot of our work is actually in rural communities. And a lot of the beneficiaries of our work are not Black and brown people, they're white folks. It's rather like this notion of WIC is somehow an urbanized program, when in fact the primary beneficiaries of WIC and other services have historically been in our white. So I think we're not going to change what we are or how we articulate being in the health disparity elimination business, but put a little more emphasis on explaining what we really do and what impact it has in terms of saving life. So we are pro-life in this sense of our day-to-day work. In the chat, I see Colleen saying that we'll be back to using the term health disparities and eliminating the word equity. And she has a question, or will the phrase health equity be on the approved list because we aren't using diversity or race? Well, anything that says equity is probably going to be attacked, but no, we're going to stay true to using the word health equity. We're going to say yes. Our goal is to assure that all Americans experience the comparable same life outcomes. That means we need an America that, from a health point of view, is more equitable. That's what we do, and that's what we're stand for. And if you want to say, if you oppose that, it's rather like saying it's okay that these lives are expendable. Okay.
Sharon.
Yes.
So ironically, on the news this morning, they addressed that particular issue, and it sounds like he has also charged his staff to be on the lookout for organizations that are trying to change the wording and the language to get under the radar of DEI, to root those out as well. So
He being Governor Braun?
he being, I'm sorry, President Trump.
Oh, okay.
So I assume that will trickle down through like-minded individuals in power.
Yeah, it probably will. And at some point, you know, we're already pushing to have a meeting with Braun directly to address these issues. We also know Mitch Rowe from Mitch's prior service, so we expect to have some conversation there as well. But yeah, I mean, just over communicate is part of what again we will continue to have to do to try to make sure we can tamp some of this down. It's going to be an interesting year. We really won't know how successful we have or have not been for probably another 6 months. But we're going to try to make sure we're talking directly to policymakers and are sort of pointing out, really asking the question of, you can be anti-diversity, equity, and inclusion, but that presumes that something's happening that we don't believe is happening. I mean, you know, there's no favoritism in that. We just don't see it. Now, and one of the things, just so you know, one of the things that I'm personally doing in some of the conversations, I'm saying, I'm a Notre Dame graduate. I have a degree in English, but also have a degree in Black Studies. And so Notre Dame helped me in a DEI way. And so is Notre Dame the problem or am I the problem? In other words, if you have a valued institution like that had a Black Studies program from which I graduated, why is that not good? And so it's just another way to try to get around saying this is not good. The other thing I can tell you is I lived in legal segregation. I didn't know anybody white until I was 10 years old, but I was born in the South. So I'm somebody who knows the vestiges of where we're heading with some of these policies. And so if I can be a kid who grew up in segregation, lived in the projects, and made it to Notre Dame, graduated Notre Dame, and have a degree in Black Studies, something in all of that was good for the society, not bad for the society. And I don't understand why they shouldn't be applauded versus attacked. But be it as it may, it's just the challenge of the day. And so again, I would just encourage to be authentic. Now, you know, you want to survive, and we may indeed become a target, and I expect us to, but that's why it then will be a question of, will Anthem, will IU Health, will all of our allies really stand with us? Now, when I've asked that question directly, like I did to CareSource, the response was immediate. If IMHC is attacked, CareSource said they absolutely will stand with us, and they're not changing any of their language around DEI. Okay, so we will try to root out or find others who would make a commitment. Either you believe what we do or you don't. And if you do, you'll become a member and you'll otherwise help us. So it's like the civil rights movement. It's time to see if we can get everybody together and get everybody on the same page, get everybody marching to the same tune. And frankly, I think the response we're going to get is going to be pretty good. I don't, in a way, not that I hope that we're attacked, but if we are, it's okay. I mean, I think it becomes a moment of truth, not for us, but for all the ally organizations out there that we've worked with over these 30 years.
Carl, thank you so much for your time. This has been, I know, enlightening and a great discussion, and you've given us some wisdom to move forward, to engage, and educate, and stay true to our values with promoting equity. So thank you so much. As Pat says, thank you for your honesty. Sheila has put some links in the chat for their legislative day, if you want to take a look at that. And if anyone has some thoughts or questions about the Indiana Minority Health Coalition, let me know, and I will put you in contact with Carl. All right. Thank you, Carl. Carl, we're going to move on to some networking, some information about what's going on in our various organizations now. So you're welcome to stay or to leave if you need to.
Okay. Well, thank you, but thank you for inviting me. I enjoyed this, and Hope to have contact with you all down the road.
Thank you, Carl.
Bye-bye.
All right. So, moving on to our information time in terms of finding out what we have going on as a network with Health Visions Midwest. I'm sorry, I'm trying to do two things at once here. So with Health Visions Midwest, team, what do we have going on that we want to talk about with the group here?
I have my Thriving Thursdays on the 2nd and 4th of every month. And this year, because of the participants being such a large class, I have asked people to RSVP because, as you all see, that my class is really large. So we started that this year, and I still have a large class. So anyone is invited. We have flyers that we put out. So anyone is invited to that. It's an hour class, started at 10 o'clock at our office. So if you're interested, let us know. We can send you flyers.
And that is what, the first and the third Thursday?
The 2nd and 4th Thursday of every month.
Okay, wonderful. Thank you, Peggy. Anyone else from the Health Visions team?
Me.
Yeah.
I'm having a collaboration with Christian Community Health, and we have this free clinic on Thursdays from 10 till 12. We are taking the first 8 patients show up there. After 11, there is not a good idea for people show up. Taking everybody, people with insurance, with not insurance, people don't want to pay the insurance, people that don't have a doctor, people couldn't get a doctor last minute. It's just on Thursday, and the care is awesome. We can do also over there like urine tests. We have referrals to send people to have like a CT scans like for $300 with discount. I'm facilitating a diabetes class. I just started. If somebody from some agency has clients or they want to have a diabetes class going on in their place, are 9 sessions, 8 classes plus the class number 9 is a party with a graduation.
Okay. Wonderful. Thank you so much, Lupita.
Mm-hmm.
Anything else from Health Visions? Okay, so we'll move on to all of you, the rest of you in the network. What is happening that you want us to know about?
Hi, Sharon. This is Sandra.
Yes, ma'am.
I just wanted to remind everyone that Cancer Services is over in the southeast side of Fort Wayne every Thursday from 1:30 to 4:30. We have a client advocate over there at 3420 East Paulding Road, which is the Impact Center that's connected on to the church over there. And we have classes over there, and we just like for people to join in and come and be a part of it. You don't have to have cancer to enjoy the activities that we have over there. And if you have anyone who needs to sign up for Cancer Services, we do have a client advocate over there every Thursday from 1:30 to 4:30.
Thank you, Sandra. And they got some good classes over there. Yoga and
Yes.
I can't remember the others.
Chair yoga, Tai Chi, and music. Yeah.
Yeah. All right. So good things for the community to take part in. Anyone else?
So on February the 12th, Tobacco-Free Allen County will be going to the State House in Indy to advocate for the $2 a pack cigarette tax. So if you're interested in joining us, we have a bus, a nice heated, comfortable bus that we'll be taking. So get a hold of me if you're interested. We'd love to have some folks go with us.
Awesome. Okay, get that $2 tax on. Okay.
Yep.
And then Sheila has been putting a lot of things in the chat regarding the legislative day. So please take a look at that if you want to take part. And there's a community health day, free COVID testing and vaccinations also at Pilgrim on Saturday, this Saturday. All right. Thank you, Sheila. Anyone else?
I dropped Go Red in there also. February 2nd, churches Go Red.
Okay. Anything else? Nothing else going on. Going once. Going twice. Okay. All right. Thank you so much, everyone. Am I missing something, team?
I don't think so.
Okay, our next meeting is going to be February 26th. And hopefully it will not be negative temperatures outside, so we can have our hybrid meeting. We are encouraging you to come in person to that meeting if you can. We wanted to start that this time around, but we couldn't because we went all virtual. And what I'm talking about is we wanted to start a giveaway for in-person attendees that will help you with your networking. So if you come, then you will be able to take part in a little drawing for a prize next month. So please try to come in person so that we can have a little networking in person. If not, of course, you are welcome to join online. So we hope to see you all 1 month from now here at 5800 Fairfield Avenue, Suite 140. All right. Thank you so much. Bye.
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 Get on the bus, you guys. I really need your support. Thank you.
Get on the bus.